I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Jonathan Lebowitz, Long Island Gynecomastia Center. We have 2 cases today. It is Tuesday, mid-July, and we got one patient here. The first patient, he's from Jersey, mid-Jersey, and he comes, I mean, he's in good shape, actually. He's got 6-pack going on, but he's got these big glands, and they're huge. He denies taking pro-hormones, but they're big, and he doesn't have really a good shape to the lateral aspect of his pec. So through discussion with him, we were talking about, should we just do gland removal only, or should we do the works, the Vaser, the Lipo, the J-Plasma to tighten up the skin? And he said that the extra cost with the Vaser and the Lipo and everything with gland removal, you always have to remove gland, is worth it to him to tighten up the skin and really have a great shape. We go down to the belly button, so I'll even etch. He's got an semblance of a 6-pack here, but we'll even make that better. Vaser and the stealth incisions here, and in the belly button. LipoSculpt, everything, his shoulders. He's got some good deltoids here, but I'll deepen that a tiny bit and really then get out these glands. Drains, probably will need a Jackson Pratt drain, because these glands are huge. You can kind of, if you come on in a little bit, see underneath the nipple, you can see it move. Mm-hmm. See? Mm-hmm. And he swore he didn't take pro-hormones. And, but they're big, so drains, I'd probably say 90% yeah. And I'll put it into the armpit there where the liposuction is, so there's no extra hole. A lot of doctors will put it here. I'll just put it right there so it's hidden. And we see him 24 hours later, do the first dressing change, and he'll look perfect. So I'm going to mark him and numb him, and to the OR we go. So here's my markings. Let's start at the top. This is a deltopectoral groove. We'll kind of deepen that a little bit. He's already got some good shoulders here, but if I deepen just a little bit, he'll have more accentuation of it. This is where I stop and don't go up here because I want to maintain volume. But from here down, I kind of transition to really get this down. Negative space, the linea alba, really give him a good indentation here. And from the lateral part of the rectus abdominal muscle laterally, kind of scoop this to the lats back here. Leave some space here, don't really kind of liposuction. There's just a little bit to smoothen it out, but maintain some volume here. The 6-pack, top, middle, and bottom. The top has this little curvature to it. Gland, get that out. Stealth incision in the armpit, at the corner of the areola and right in the nipple. And really scoop him out here so he's got a real athletic chest. So I'm going to numb him in these areas and get to the OR, and we move on. Okay, so more numbing. So you're numbing these little tiny areas. So I go through these little tiny areas. Okay. Right, and I now go into that little spot, which is numb, and I pump you up. Pump you up. So these are big glands. So I'm getting, right now, I'm getting under it because I'm comfortable with what I do. So I'm hugging the pec. There's gonna be big glands. I think he took something. He's denying.
I'm denying.
Yeah, but maybe you took something you didn't even know about.
I probably did. No,
you know, something, because back then, GNC, whatever, all this, these companies, you would get things that you would get them.
It was the eggs you ate.
You would get it, and they're like, you know,
mislabeled.
Not mislabeled, but they're
inappropriately labeled. Not FDA approved.
Or they used to have these things on shelves that were
left it out.
So who knows? So we're separating the gland. See, I'm going superficial here over the gland. Over here, laterally. right, so now we
Suck you out.
suck you out.
We're here to suck you out.
Arnold. Bueller. Bueller.
Bueller. Bueller.
J-Plasma. See that? Gas is an element, helium, the lightest element, and there's a little radio frequency spark at the end. And what it does, it heats. More heat to tighten. Dr. Lebowitz, Long Island Gynecomastia Center. So it wasn't that bad, but he had 2 huge glands and some fat, and we elected to do everything. The Vaser Hi-Definition PowerX Lipo, obviously gyno gland removal, and J-Plasma for skin tightening. So these are the pre-ops right here, and now these are the immediate post-op, still laying on the table, still with local anesthesia in them. And I just gave him great definition. The chest is flat. He's got drains, how to use drains because the sheer size of these glands, which I'm going to show you in a minute. So these drains kind of sweep up in there, and he's still swollen. Look at this midline now. Suck in your belly. Suck in your belly hard. Really hard. There you go. Look at this. Look at this midline I gave. That. And he also has the horizontal inscriptions of the rectus muscle. This is just some fluid in there that's going to come out. Luis is looking at his belly. seeing if he's got this, he's got this. But look at that. Linea alba right there. The semilunaris right there. Now suck in your belly. There you go. You can kind of see the hint of this stuff coming on here. And when the swelling goes down and the fluid drains out, he will look amazing. Do a little crunch. Excellent. That looks great. Now do a little like a little crunch sit up there. There you go. Or actually do a stomach vacuum. There you go. That's it. A great stomach vacuum. That's perfect. Right there. Make a muscle. Animate your pecs. That's the drain going on there. And he looks great. Do a stomach vacuum. Stomach vacuum. There you go. And make a muscle your chest. That's what you got. And do a little crunch. Just a little crunch. There you go. Excellent. And that's the results that he's going to get and look absolutely amazing. Swelling will go down. Scar tissue will form here and tighten everything up with the J-Plasma glands we got out here. These are two pretty nice sized glands, especially after lipo. And we got out 1.25 liters of fat right out there. That whole canister, which is 1,250. So fat, glands, excellent results. So this is it. Deltopectoral grooves, lats, pecs, abs, everything included with my gynecomastia surgery. Dr. Lebowitz, 631-424-0101. Thanks and see you soon.